Good Heart Hospice. Who qualifies for hospice care? At Good Heart Hospice, we believe every patient deserves independence and dignity as they approach the final stages of their illness. We are a California-based hospice and palliative care provider dedicated to giving patients with terminal conditions the care they need to live comfortably, surrounded by a team of professionals and loved ones with their best interests at heart. Who qualifies for hospice care? Before a patient can begin the process of seeking out hospice care providers, a physician must first determine their eligibility. A terminal illness must be confirmed, and it must be in its final stages. Generally, the patient is given a life expectancy of 6 months or less, depending on the severity of the condition. More specifically, there are 3 primary indicators that a physician looks for prior to recommending hospice care. The first is a distinct lack of improvement in the patient's condition despite treatment. The second is the presence of acute health events, such as a heart attack or stroke. Finally, if the patient is becoming anxious about the prospect of death and determines that they do not want to spend any more time in a hospital attempting to treat the condition, then a doctor will refer a patient to hospice care. After the referral, the hospice medical director must agree with the doctor's recommendation. A hospice nurse will visit the patient and conduct a health assessment, looking for common signs of declining health, such as 10% weight loss within the previous 3 to 6 months, insufficient hydration and nutrition, decreased ability to benefit from nutritional support, trouble swallowing, shortness of breath, inability to perform common daily activities, increased fatigue, progressively worse incontinence, recurrent infections, cognitive impairment, repeated visits to the hospital or emergency room, rapid disease progression, and pain and emotional suffering. After reviewing the patient's condition, the hospice medical director will make a final decision. If the patient is deemed eligible, they must elect to receive it in place of curative care. If a patient in hospice care lives beyond 6 months, they are eligible for an unlimited number of 60-day benefit periods. But the evaluation process must be repeated, and the patient should be recertified as terminally ill. Meetings to reapply to hospice care must begin no sooner than 30 days before the end of the current benefit period. Make sure you understand your insurance company's policies about continuing coverage before the process is begun again. Hospice care is covered under the Medicare Hospice benefit for patients covered by Medicare and eligible for Medicare Part A, hospital insurance. Additionally, income-eligible Medicaid patients also receive a hospice benefit. Private insurance companies also provide some degree of hospice coverage. It is important to remember that without approval from a physician and hospice care team, most costs associated with hospice care will require out-of-pocket payment. The final stage of your life shouldn't be spent fighting a fruitless war against an uncurable disease. Allow Good Heart's team of qualified and professional caregivers to help you spend that time in comfort, doing what you love, celebrating a life well lived with your closest family and friends. Good Heart Hospice can be reached on our website, goodhearthospice.com, as well as by email at info@goodhearthospice.com and by phone at 909-989-9988. Our offices are located in Suite 115 at 8237 Rochester Avenue in Rancho Cucamonga, California.